Hey guys, it's Jeanette. I hope you're all doing well. I wanted to talk to you guys why I chose the acute care adult gerontology nurse practitioner track for my master's degree. So the first thing that I was told was to find out who do I want to take care of, what age population, and in what setting. When I had my counselor interview slash like Q&A session, those were kind of questions that I wanted to ask to make sure that I chose the correct track for my personal goals. So for me, I want to stick with the adult gerontology population because most of the patients in the ICU that I currently take care of are adults and are elderly. So I didn't want to, in a sense, learn a whole new population, and I wanted to just build on the foundation that I have already started. So that was the first thing. And then second was in what setting. So I have had administrative jobs before, jobs that I sat down a lot, and I really enjoy the hospital setting. It could be chaotic, it could be crazy, but I love that environment. So I wanted to make sure that the master's degree track that I pursue would allow me to be hired and to be able to work in a hospital setting. So the third thing is that I love acute care. I love critical care. I love working in the ICU. I like seeing different things. So with those three basic answers in terms of what were my personal goals, the acute care adult gerontology program seemed to be the best fit. So just a quick summary of the differences between the two, which may help you as you decide, is with acute care track, you are able to take care of patients with like acute illnesses in a hospital or emergency room setting. So they most likely are more critical with life-threatening issues, and you can see them in the hospital as well as an outpatient scenario environment. So the FNP is more focused on the primary care, could take care of acute issues as long as they're not life-threatening in an outpatient clinic setting. So what I learned after meeting with the program advisor was that the board is trying to make sure that we have a good definition for the advanced practice nurses, the nurse practitioners, of what each track, each specialty, what their scope of practice should include, especially identifying and clarifying which setting they can practice in. So I was really shocked because I'm sure I've seen FNPs in my facility, and I was told that in the future they will be making those changes where FNPs can't be hired to take care in a hospital setting. And I think obviously there's exceptions, like let's say if the physician they work with rounds in the hospitals, of course they can come in, but I'm specifically just saying, like, let's say an ER NP needs to be an acute care or whatever NP versus an FNP. So they told me to look out for changes that the board is making, and yeah, so I guess that's pretty much the basics of it. So as you decide whether you're going to pursue your master's and in which specialty, I believe there's 6: women's health, psych, maybe pediatrics, what else? Adult acute care, and then I think adult primary care. Don't quote me on that. I'm just going off the top of my head. So yeah, try and make sure that you find out where do you see yourself working in about 10 years and what population, in what setting. Those would be key questions as you start your research journey. And then from there, find the programs that have those tracks so you're not just accepting an offer from school A who has an FNP program and you've never wanted to work in a clinic setting. So yeah, I hope that helps. Short video. If you have any questions, please leave it in the comment section below. Don't forget to comment, like, and subscribe, and share the videos. Bye.